Going to go and get started. Dr. Turner is going to pinch hit. So now batting, James Turner.
Okay. Here we go. Thank you. Could we please call the meeting to order? And a roll call, please.
Mr. Pass. Dr. Turner.
Present.
Dr. Lynn. Dr. Caddick.
Present.
Dr. Ross.
Present.
Dr. Todd.
Present.
And
Here.
A discussion about the minutes of the last meeting of November 18th. It's an action item to vote on the minutes, whether they're approved or not. Any discussions or concerns? Or a motion to approve?
Motion to approve?
So moved. Is there a second?
Second.
Second. We're going to take a vote on that, please. All those in favor?
Aye.
Opposed? Can we move on to the financial report, please? Rhonda?
All right. Yeah. Right now, there is no financial report because we have a lot of new people. In December and January, they're catching up for the whole year. So this will run a little bit late. So once I receive it, then I will send it to you in an email and let you look at it that way. Is that that's acceptable?
How about if we skip down to old business? Or do you want to, we'll skip the election part until it gets here? You want to do that? Okay.
Government.
Yeah. Everybody wearing masks.
Oh, you're,
Oh, we're
I
separated.
think you're okay. And I can move forward with my part, Jim, if you want. And
No. So should we go to new business and,
yeah, I'll do the health officer report here, and also want to recognize a few brand new faces in the room and give them an opportunity to introduce themselves. So we have two new members joining us tonight. This is James Big Dog Jimmy McKenna up here on the far left. He doesn't go by Big Dog, but Jimmy just appointed just today, right? Today or the, okay. Yeah, so Jimmy, you want to tell us a little bit about your background? And
Great, yeah. My name is Jimmy McKenna, lifetime Vigo County resident, respiratory therapist, Union Health. I've been in healthcare since I've been 19 years old. Right now, I'm currently over the respiratory therapy department, pulmonary cardiac rehab, and the fitness center at Union Health. I have 4 children, ages 15 to 5, and that's the reason I'm up here for the next generation.
we're very happy to have you. Thank you for joining us. And we have Dr. Jennifer Todd sitting right here in the middle of the room.
Hello, my name's Jennifer Todd. I am a clinical social worker here, licensed clinical social worker in Indiana. And I am also pretty much a lifelong member of Vigo County with a few stints out, and I always came back. So I'm also a faculty member with the Department of Social Work at Indiana State University. And I am happy to be here. Appreciated the invitation to join the board. And I have 2 children that have just left the nest, so I have a little more time on my hands. And I think that's it.
We're thrilled to welcome you both to the squad here. So, to the squad, absolutely. One more guest I want to recognize is sitting in the back of the room over here. This is a gentleman's name's Mark Casanova. He's the new CEO of Regional Hospital. He wanted to come and meet this machine and see it in action here tonight. Mark, you want to take a quick second and introduce yourself? And
Yeah, absolutely. Thank you, Dr. Brogan. Hey, it's a pleasure to be here. Let's talk about healthcare since 1996. Respiratory therapist. Remember right there. My first 10 years in healthcare was as the last 15 years have been in administration. I ran 2 facilities in South Texas. Christie area with plenty of kids,
thank you. We're excited to have Mark welcome us, as a healthcare partner for the board as well. So, absolutely, yeah. Contact tracers. We got a lot of new faces up here since the last. So, want to introduce yourselves quickly and. Yeah.
I am Ashley Stewart. Jody pulled me out of my stay-at-home mom gig. I have a public health degree, community health promotion degree from Indiana State, but it's that I, here's my husband comes back. So, here I am, I enjoy it, I love it, I feel like I'm saving lives. So, it was something, I hope.
If Ronnie goes on maternity leave, Ashley will step in. He was, as you ever have, like, graduate high school. Anybody else? Robert?
Yes.
Robert Foreman, Fraser, and also, all right, that's our game.
Yes. They do an unbelievable job, and thank each and every one of you again. So, as far as communications, from me, since the vaccine rollout has started to really ramp up, communications between myself and Dr. Box and Dr. Weaver's kind of dried up as well because everybody's busy. Things have been turned over to a local level. For me, I get to ride in the back seat of the Tesla on autopilot here while you guys do all the work, which is awesome. Cannot ask for anything more from this squad, from Joni, and did I see Andrea walk in earlier? She's there in the back. Just everybody, the team effort that continues to get put forth is just, it's jaw-dropping, the amount of dedication that just pours out of this place every single day. The vaccine rollout has really gone about as well as expected. Our Achilles heel is always what we get from the state. So after that, I don't lose a wink of sleep at night worrying about what we're doing on a local level. If we get the drug, we're going to put it in people's arms, and it's going to happen flawlessly and tirelessly, and I certainly applaud your guys' effort and your dedication, for sure. Things are shifting, are changing. We're the second round of vaccine has come to healthcare workers already. I'm fully vaccinated. I got my rabies, my distemper, I got it all. So, yes, yeah, I'm looking for my forever home at this point. So, but it's a wonderful feeling for you guys that have gotten some vaccines already and going to get your second. It's for me as a healthcare provider, and Dr. Turner will probably echo the same. It's nice to feel inspired for a change that maybe we're getting closer. And if we can get our old folks immunized, our long-term care people immunized, our healthcare delivery system immunized, after that, I'm hopeful it's going to be kind of on cruise control. Our county continues to do very, very well. When we look at other counties in particular, we look at our hospitalization rates right now. They're in check right now. That could change at any time based on long-term care. Okay, our long-term care, Grandma Jane back there, she has done an unbelievable job hounding people and aggravating people to the point of just they're going to do what she says, regardless, and that's paid dividends. I think a lot of counties around us are in a lot of trouble because of long-term care facilities. But when there's smoke, Grandma Jane is on the case, and she puts it out quickly. So we have her to thank for that long-term care control. So that does not go unnoticed, Jane. So outside of that, you guys you're doing an unbelievable job. Keep it up, and we'll go from there. Thank you.
Darren, I was going to read a couple things, if that's okay.
Absolutely.
This is some of the updates from Union Hospital. Can you hear me okay? I know with the mask, it's kind of hard. Just some updates they put out today. Union has safely discharged 668 patients with COVID-19. Right now, there are 43 patients hospitalized, 40 tested positive. That puts us about an 18.9% rate. The respiratory clinic at Convenient Care has evaluated and tested nearly 10,000 patients for COVID-19 since it began. We're doing about 30 to 60 patients a day there. I think one of the most interesting things biologically is every year we pay attention to the flu season, of course. On a national and state level, influenza activity is at all-time low. Last year at this time, Union had tested 1,648 patients for influenza and had 162 positives. This year, we have tested just 512 patients with 0 positive influenza cases. Unbelievable. The clinic, that some of you may have got your immunizations, I got mine at the Lansbaum Center. The clinic has now administered over 6,500 doses, and a dedicated team is vaccinating over 300 people per day. At this time, the Lansbaum schedule is full, with no slots through February 12th. But with more vaccines and more time coming, we hope to be able to increase that. I assume the influenza is from masking, social distancing, hand washing. Isn't that amazing? That's more effective than the flu vaccine. I think the other thing too, though, is so many school-age children, particularly in Illinois, have been not in school. And traditionally, what I've seen over my 30 years in rural practice is it's the school-age children that tend to bring the flu home and spread it through the community. So we've had a lot of kids out of school, and I think that's played a role too. But can you imagine if somebody would have come to us a year ago, last January, before this ever started, and said, we're going to have 0 cases of influenza this year? That was our big drive, to get people vaccinated. So what an interesting thing, that has made for us. And so
Certainly take it.
I'm
Take
kind
the
of
good luck.
following your lead. Should we wait for elections till Jeff gets here? Want to go ahead and do that?
Yeah.
We can wait. We can do it.
Should do program updates.
Yeah, let's go ahead and wait. Let's do that at the end when
Sure.
everybody's
Sounds good.
We
Yeah.
got a quorum. Should we go to old business? We there? Okay.
Yeah.
Good for you. Program updates. Could we start with nursing, please? Chelsea? Okay.
Yeah. If you guys don't mind too, just please introduce yourselves to the new members.
My name is Andrea Kraft. I am one of the nurses at the clinic. I've been here for almost 3 years, and since everyone else said something about their school, I have a psych degree from Ohio State. I have my bachelor's from Indiana State, and then I'm going for my bachelor's to doctorate at Maryville University. So,
I am Twyla Spidell. I went to ISU and I got a bachelor's there, an RN, and I'm not as educated as Andrea.
I'm Jane Keys. I'm a retired public health nurse. Was here before, left in 2015, came back just last year to do COVID, case management for COVID contact tracing. And then I had long-term care. What I can say that I've seen about long-term care, just throw it under your hat, they've had 1 dose. About everyone in every facility, I've seen the cases drop. So you know something's working. There's still a few facilities that are seeing ticking up, but not bad. I think they've all done an awesome job. It wasn't me that did it. It was all the administrators. We worked as a team. But I have a degree in nursing, and I still kept my license, so now I'm giving the COVID vaccine, and I feel good about it. That's a positive step.
So mostly, I mean, we did go back to clinic. We started doing vaccinations in clinic, doing TB testing. I do the TB control, so medications still continue to go out. Even when everything was closed, it still continued. And then still the investigations for the state of all the communicable diseases, infectious diseases, that continued too. But then once the COVID vaccine was available, we've started up doing vaccination clinic here. We have done with 2 vaccinators at first. We just added a 3rd vaccinator today. So between 60 to 90 a day come in. We are using Moderna. And when you open a vial, it's a 10 dose, and so you've got to use it all. So if we have anybody that doesn't show up, then we find people to fill the slot so that none of it is wasted. And then we're going to be going probably soon, probably the beginning of February, to another location. Should I say where yet, Joni, or is that still in the works? Okay. Yeah. So we're planning on going to the building at Sears, which was in the mall, and doing more of an outreach there. We just got a large number of vaccine in. Was it 1,500 the other day? Yeah, 1,500 doses. So we're going to be reaching out even more to that. Andrew, you want to add anything?
In total, we have received 3,000 doses. Our clinic started on January 12th, and like Twyla said, we started off just 60 a day, kind of slow. We've added another vaccinator, so now we're doing 90 a day. So as a total, we've done 410. So doesn't seem as much, of course, as Union, other places, but we're still making a difference. Like Twyla said, we're also going to start at Sears on February 1st. It looks like we will be having about 6 vaccinators. We're still trying to figure out all the details, but it looks like 6 vaccinators will do about 180 a day, 900 a week. So.
And since that's 5 days a week, and it's 7 hours a day, and that'll be 5,000 per week.
Oh, okay, it's different.
And add more vaccinators as needed. If there staff or as well, as they've done in the past, who are FA at the jail and at the but that's what helps out a lot. A lot of people out there are universities, pharmacy techs, or put the data in part of it. Andrew's been working with Carolyn Lamar. Carolyn left her daughter. He's one to set up our smallpox clinics, or our mass protein clinics for those shortages, where we run around today. So with Andrea's base knowledge, Carolyn Lamar's.
There was a lot of press about things that happened in the jail in the last couple weeks or so, or a couple months. Are we vaccinating those inmates? Is that our responsibility, or does it come from somewhere else? Or?
I don't know how the bills get part of the correction. Yeah, we haven't, I know FCC, Terre-Haute, and St. Clair's, but I don't know how it's part of the correction. But I do know that there is, that's all the things, and I would look up with Professor Rice, plus I've already been in the jail, that the start to know how safe it is and the type of throughput needed to have tape. We also got the Biomax antigen test kits, so anybody that's not it,
Because it's a challenge in all those areas, of course, and we did such a great job with Hep A. You guys just went in there and got after it. You know, so probably 300 inmates maybe in the county jail.
I would
3 or
say,
4.
yeah.
So it could be done, you know, aggressively.
that was always a change in population. We had to make sure that once we went back, somebody that you had already done the month before, and
Yeah.
still there.
Plus, it's voluntary for the
Yeah.
inmates, so.
Can I ask, are you getting much reports of side effects?
Just a few, actually. Jane has talked with a couple of people, just normal side effects like headache, feeling achy, a slight temp, things like that.
There's
So.
one that had COVID, that's had COVID in October. He actually came in, and it's not on the questions to ask if he had COVID before. Today's, just a little bit of soreness, fever, chills, body aches, but he was in intensive care for 2 months. So he had COVID, extreme, and I talked to Dr. Brecken, he helped me, and just kind of one of those things, it's 24, 48 hours, he should get better.
Yeah.
So he's just right at 24 hours. So we're going to have that a little bit. I had my COVID vaccine, and I had COVID. So we're going to see tomorrow. Hopefully I won't be going, oh, I feel bad. That's a little bit, not bad.
Sure.
Yeah.
Nobody had any
That-
reactions
that-
to your giving it.
That's what I'm hearing from Lambsbaum Center, some sore arms, but nothing.
Yeah,
I
nothing
don't
bad.
think
And I
one
talked-
significant one out of those
Yeah, I talked
6,000.
to Ann Smith today at Union, and we kind of combined that just to see what they were doing. Everybody's doing pretty good,
I think so.
really.
Yes.
That was the, in 4 hours, was good. It was about 50% acceptance rate. So when we looked at our county at 107,000 population as per July of 2019, I was able to take out how many kids were under the age of 18, and then take out the federal prison population. I looked at how many people fell into the 780s category that are already right now, considering how many first responders and frontline workers fell into. So we're really looking at, and we have that, that's what the census is about. So we're really looking at vaccinating about 8,000 to 30,000 people. So when you continue that, the FDA, both of them got it, but the one very considering is this, I don't think it is.
For Valley?
Yes.
I think we're talking about doing it like Wednesday afternoons,
Okay.
trying to work out the flow.
Rotations. And then the pharmacies are getting enrolled to help us out from this way. So I think that once the federal government is going for the vaccine, that's going to help out with getting everybody vaccinated at a faster pace. And it is. And once you see the people taking that 50%, maybe those who don't want it, then feel more comfortable with the higher acceptance.
Thank you.
It's certainly, it's kind of like hitting a moving target right now, but, you know, as the federal government releases the vaccine to the state, we get it delegated to us as, you know, if we get some godsend, hey, you guys are going to get 3,000 doses per week, we will figure out a way to get them in everybody's arms immediately.
Yes.
So we will ramp up. Yeah, absolutely.
I went very scenario, 12 vaccinators, 32 would be perfect. Everybody would have done it to us. Believe it or not, with both doses.
Just need the juice.
And that would be 190 per hour, which would be just tremendous. That was 6,700. That means we create our mass protein plan, our layout. We'll take into consideration the maximum dose that we get to run here, and then stand it up to what we actually have. And again, first students that are there, even if they're not vaccinated, they can take the observation. They can see how prepared this works. Yours, a large clinic, it can be an educational learning thing, so it'll be okay.
We're on a path, aren't we?
Yes. That's what I
You
said.
know,
I'm
really,
finally-
what the department has done in the past year has been amazing, really. We started at ground zero, there was nothing. We put together a whole infrastructure system that's
And the guidance
Going.
changes, you can go to bed, you can wait for night, wake up the next morning, it's
That's
completely
true.
different. By the time we get on our joint information call, which we do every Wednesday at 2, with all of our partners, they can change their call. Whoa, take this, great call.
You know, we used the term months ago, uncharted waters. We're still there. You know, we're still there. But we're learning more every day, so.
Can I ask a question about this also? For those people who have signed up and they're far out, let's say into mid-February or so, when you get new opportunities for vaccination, are you just going to take new people, or are you going to move them for, I'm just curious how that will
Yes.
go.
The only way that an individual can sign up for that SOCHEC platform, which is the Indiana State Department of Health, can control it, tell them how many vaccinators we have, how much vaccine, and that way they know how many slots have to be made. So once that appointment is already dated for that person, they're really locked in. But I suppose that in the times that we've been able to override the system, you know, when somebody does 30% lung class, but it's felt like the advertising really caused just to go up.
So some people may get in sooner just because of the opening up versus someone who signed up 2 weeks ago, they're still going to.
Had some no-shows last, and primarily from the company that had gone on and registered their employees while we work. A lot about really great stuff. So I think that's how we had, so no shows, we haven't had any since last Thursday. mandated to have an internal wait list, be able to grab somebody fast, but no dose wasted. Every dose is accounted for. So if you hear out there, hospitals throwing away or whatever, we'll get fined if there is a dose that's not accounted for. That's the same for other. And we also have EMS on site. Very
Okay. Health education, Ronnie?
Hello, everyone. I'm Ronnie. I'm the health educator and media coordinator. Things usually look a little different with what I do, just because I have programs and I normally go out and do presentations in schools and for different organizations. But with COVID, that's kind of all I do right now. So I run the Facebook page, so posting every week, every day, whatever's going on, answering the questions, complaints, just kind of seeing what's out there on social media in regards to rumors and false information, so that way we can kind of nip that or like know what we need to talk to people about. A lot of media interviews, so I have all my media topics on here. Again, a lot of COVID related things, but also throw in a few holiday guidelines, influenza, just whatever's going on currently to try to make sure the public is aware. Marcy makes us weekly graphs of the COVID cases, and when she sends me those, I get those put up on all of our social media. I send them out to the JIC, and then talk about them on the news if they want to talk about them that week. So those are also included in here. If you guys want to check out how our graphs are doing, had a little bit of a decline this last week, so hopefully we'll stay on that track. But other than that, I mean, that's kind of my bread and butter right now. Do you guys have any questions or anything you want to see more of on our media or anything?
If you want her to add you to our joint information committee, let us know. We send out a message every single day with the cases breaking down by inmates, all that kind of stuff, so you get a real-time picture. And for ours, graphs, kind of give you a feel on where we're at.
Yeah. Anything you guys ever need or any topics you ever think are important, just send them over to me and I'll get them up. Thanks, guys.
Thank you.
Vital statistics, Rita, please.
Hi guys, Loretta couldn't be here this evening. This is Brooke Bolts. So all of our numbers on our report were submitted to you guys, and then I also did my death numbers for the increase of death from last year to this year and how many of them are COVID. And it's broken down also to, there was 81 women total so far and 78 men in their age groups. Is there any questions?
So do you provide the numbers that get put in the paper every day, or who?
I provide death certificates to Ronnie and we keep track of it that way. Yeah.
I'm going to touch base on Drive, the wonderful system that is Drive.
Okay. So we were implemented a new statewide system for birth and death records. It took place January the 4th. And we are slowly making progress with it, but there are some hiccups. Yeah.
Yeah.
It is a
Yeah, it's
nightmare.
still-
It actually is a nightmare, yeah.
So,
I have one in my office that's sitting there. We couldn't go through, and even spoke to somebody here.
Yep.
My secretary did, and she went to the state, and they still, so we'll give it a little bit of time. And the trouble is, people cannot be cremated, is that correct, or buried without the death certificate? Or?
They can be buried. As far as the cremation goes, they are able to have a letter written from our coroner. They implemented that with this new system since
Some of the doctors weren't registered on time. There's system issues with even the funeral homes being invalid users, but it is being taken care of on a daily basis.
The last system seemed to work pretty well.
I miss it.
I thought, it was pretty clean and,
It was,
but,
yeah,
families can't do a lot of their paperwork without that death certificate.
yeah.
Life insurance policies and so forth, so it's a very important thing.
Yeah, they're rolling out. I did the most so far yesterday at 14. So they are coming through. Anything from January 1st on is very simple and quick. It's the ones that were inputted in that were transferred over that we're having the most problems with.
Thank you.
You're welcome.
Okay. Environmental, please. Amanda?
Hello.
Hi.
Amanda Bells, Executive Administrator, Environmental Health Supervisor. Some things that we've currently been working on is getting all of our food establishments renewed for their food permits. We roughly have about 500 that we renew every January. We have, roughly 30 that's late this year. So we're working on those people getting them in. Some other things that we've been working on is helping with screening phone calls coming in about COVID. We met with the state fire marshal back in December about code enforcement with social distancing, mask wearing. We're able to forward complaints to them so that they can help back us up on the enforcement piece. Let's see, what else? Yes. We've also been working on approving plans set in place for big events, but since the governor's restricted that, we haven't had too many of those. Anything else? Any questions?
Amanda, I was curious. I'd read an article last weekend that America has lost over 100,000 restaurants, mostly many mom and pop neighborhood restaurants and so forth. And do you get a feel for that here locally?
We've only had a few close.
Okay.
Yeah, but we've been pretty fortunate.
Well, we're eaters here in the Wabash Valley.
That's right.
That's right.
And we're a hub too for the counties around us.
Sure.
Yeah, we've had a few new ones come about too,
Thank
new
you.
openings, so.
Vector control, Mike?
My name is Mike Graylis. I'm the Vector Control Supervisor. Normally, I'd be up here talking to you guys about West Nile and mosquitoes, but bats and rats, you had to throw that in there, Tony. But at this time of the year, of course, we don't have a problem with that. So me and my guys and girls are doing vehicle and equipment repair and maintenance and staying busy and looking forward to a whole brand new year. And I did get my shot today, Doc. They didn't deworm me, but
Yeah.
I'm looking forward to that one. Anybody have any questions? All right, thank you.
Our vector control division is located at our compound, it's at 6,000 feet. And the other programs that will start in springtime with our tire prints, gather up tires for mosquitoes, and that also about our large size mosquito program. And then at any time you want to come up and take a look at all the tours, shadow all the people, so that you're always welcome.
And it's an interesting visit. I joined the board in 2002 or 2003, and I still remember to this day walking through that facility for the first time. So awe-inspiring to see it work, so.
We gather mosquito samples to send to the state for West Nile virus. Clean tires for us, had the medical clean tires for us.
Have we seen any virus from Michigan come down, the equine,
Encephalitis virus.
encephalitis virus?
Yeah.
I'm sorry, I couldn't hear you.
The virus, mosquito-borne encephalitis virus from
Any of the
Michigan?
Equine encephalitis virus, we have Indiana. I don't know that Indiana's reported any, have they?
No, we've not. But I know that, like Joni said, we will start our tar amnesty program again this year, because everywhere you look, there's tars.
Yeah.
We do take volunteers, as Joni pointed out. Dr. Turner has volunteered several times. We take volunteers for our tar amnesty program, as well as any time you want to come out, set out a light trap, or count mosquitoes, or sort them, or take your help, that's for sure.
Lay on the ground and count bats, walls, so that we know how many, where to put the weekly, put the bat scratch to, and lay there every night on the ground until the animal comes out, and we will put up.
Yeah, it's fun.
Yes, and that
How
would
old
like
do
to-
you have to be to do that?
you have to be old enough to be a contact tracer.
Which is
And then
18?
as soon as you're old enough, you can sling tires too.
Okay.
Yeah.
So 12 is too young then, huh?
We'll take anybody to haul tires, so.
Okay.
I would like to thank everybody for their Toys for Tots. We raised over $1,600 this year for Toys for Tots. So y'all pat yourself on the back. Great job.
Thank you, Mike.
For some of you young people who are interested in epidemiology and infectious disease, I gave Mike a book last year, which I read also, just called Mosquito. I don't know if any of you have heard of it or seen it. It was reviewed in Scientific American. It's a fascinating book. It goes back to mosquito-borne illnesses. It starts in the Egyptian days. Malaria was in the mummies, and tracking how mosquitoes, yellow fever, malaria changed history in so many different ways, including here in the United States, particularly during the Revolutionary War and the Civil War. Mosquitoes stopped the British as they tried to come up through South Carolina later on in the war. And so mosquitoes have had a huge economic impact on the world. So if you're interested in that sort of thing, it's just called Mosquito, and it's a fascinating book and so forth. Joni, did we skip over some things you wanted to talk about in the middle there? Was there, do you have a report from you? Or?
I have the business from
Jim, I think we can,
and no, we can't do it with our registered person as an oversight at our industry. But we'd like to be able to go past 2-year degree, but has 5 degrees. That was only on our job description for the administrator or environmentalist. Something job, but as for it, so we're the ones that have our job.
So is that an action item to vote on? Okay. Is there a motion to approve that?
Or are there any questions?
Questions, I'm sorry.
need to revisit it just a little bit for the people? Okay.
Great, that'd be great.
Yeah, so when was it when they had that company? 2015, the county had a auditing company come through basically, and they kind of redid job descriptions, and they changed the pay scale for everyone that works within the department. And they put new guidelines and restrictions on everything, and it changed the pay scale moving forward forever. So it took out a lot of the time that you put into public health that used to factor into people's pay scales, and unfortunately, it either froze people's salaries at that point, they're never going to make another dime, but it also created a gap where someone with zero public health experience could come through with a degree and start making more money than somebody that's been on the job for 37 years. So before, the county's pay scale was all about experience, pure education plus experience. It was a nice model. And what Joni's proposed addendum here is to allow the Department of Health to utilize the Board of Health's descriptions, because you guys describe everyone's description out here specifically for Indiana code, to allow us in the hiring process to factor in experience along with education and training, not to alleviate or not to mitigate somebody's experience level. Right now, as it stands, they don't care about experience. So they would rather us take a 4-year degree person, for instance, from an environmentalist standpoint, 4-year degree with 0 experience versus a 2-year degree with 15 years of experience. And we know from doing this that we'd much rather have somebody that's experienced, less training, less room for error. So that's the proposed amendment before you guys for consideration, basically to add that from the board's perspective. Is that
Would this just be for hiring purposes or also the pay scale that you referenced as well?
How many of your employees do you think this would affect? How many do you have that were either frozen or locked in?
There's infected. I have that, yes, but
Okay.
Amanda Bales has been here 15 years, environmental supervisor in the private sector after your last August. From then, that opened up, he was all of her 15 years, first, all of her service, and now they, that job is lower than the work for her. But that's not what we're asking, because that's something we're hoping and we'll work on putting that, but, or like, they did job descriptions, they took on the experience as far as in the hiring process. And they want to look at like where you're work. They still would walk and make you what the. And I'll be, there's a person in counties around us that resides in Vigo, as is environmental health, it's a decade, as administrative abilities, the flight school for our department. And right now, as it is, it's that, you know, 3 or experience, partners removed, it's not qualified. It is. That's what we're looking for, is that 4 experience added back on, a 2-year degree or a campus.
So approval from this board would still require oversight from the county council as far as the budget goes with that? So we would give the approval for this change, and then the rest of the county's budget would be?
And the introductory pay would not change for the
Okay.
position. We don't have the ability to change that.
Gotcha.
So it's just the ability to hire candidate A based on 2-year degree plus experience versus candidate B with just education.
Thank you.
I'll make a motion to accept this.
I'll second it.
Been a motion to second. All those in favor?
Aye.
Aye.
All those opposed? Motion passes. Anything else, Darren?
Yeah,
Anything?
let's, we can go ahead and do, I think, section A here. Jeff has been reappointed, correct?
Yeah. Jimmy's great. Yeah, I go by Jimmy.
Big
No,
dog.
don't, Big Dog. No,
Big
I
Dog.
don't know Big Dog. He made that one up. He made that one up today. From the board, I would like to nominate Dr. James Turner as chairman.
I'll second that.
There's a motion.
Can I get a motion for that?
Been moved and second.
Perfect.
Second?
Guys.
Do you humbly accept?
She's
I don't know how, you
She
know.
seconded.
There's a motion and a second to nominate me, I guess, as chairman. All those in favor?
Aye.
Aye.
Opposed? Okay, thank you very much. I appreciate the honor. Thank you.
That's right. Great job.
I'm sorry?
That's right.
Hey, it's inauguration day,
I'm the old
bud.
gray man.
He wants to go by president instead of chairperson.
That's right.
Change his
Same
right.
salary, I think, right?
Same salary.
0.0. Shall we vote for vice president? Same vice president. Are there open for nominations?
Floor is open.
I would like to nominate Jim Bibby, with his years of experience, vice chairman. Is there a second?
Second.
You have a second?
All those in favor?
Aye.
Aye. Opposed? The motion passes. Jim will be our vice chairman.
All right.
Thank you.
Is there anything else? Citizens input?
Does anybody have any questions, just from a medical standpoint, about the vaccine, the illness, medical updates, anything that myself or Dr. Turner can address? Happy to do so. Everyone got a good grasp on everything at this point, right? Okay.
I just want to thank everybody for the opportunity to continue to serve, but what this department has had to do in the past year is really astronomical. Completely changed gears, but keeping everything else going. You know, vaccinations, well, child checks, birth and death thing, everything else, but you've all jumped into all these other departments from how hard is tracing to get yelled at on the phone? You guys been yelled at all? Cussed at? Okay. It's really, really difficult, and you've all stood up and do that. But the bottom line, what we do here is we're saving lives. It's making a difference. And you know, now, I imagine everybody in this room certainly knows somebody who's had COVID. Everybody in this room knows somebody who's died. We all know somebody who's died now. The numbers are so great. And you look at the inauguration ceremony last night with, you know, honoring the 400,000 Americans who have died. Who would have thought we would be there? So our job as a health department is to promote that vaccination, tell people down, I got mine, it's going to be the best thing for you, we'll get it organized for you, we've seen no side effects. The key is the vaccination for this, you know, and to continue to do what we're doing. It's not political about wearing a mask, it's smart. And look what it did. I'm amazed that the mask took out influenza. This has been our huge killer. I mean, 1918 influenza, you know, 100 years ago, you know, killed 70 million people. And we've all known people who've died of the flu. So what a huge thing we've made with that. So anyway, let's keep on mission and doing what we're doing, and we're going to get this under control.
I'll give you guys just a little point of perspective. I dug up a piece of paper on March the 16th of 2021. I actually presented to my current CEO at that time of the hospital about the emerging issue with coronavirus. And I gave them the statistics of how many people had died in the United States as of that day. 43 on March the 16th. So now we're at 400,000.
7 hours a day, 7 days a week, every day. Thanksgiving is the first holiday off. From one of those things, and I would say a lot of people stay to live. We're all enthusiastic about what we do, love what we do. That's what's kept us going. Love public health.
10 o'clock Monday through Friday, most days, unless there's something going on. There's the contact tracers meeting takes place. You guys, I'm sure the invite's been passed down to you. It's fascinating to attend. Great. You guys can call in and visit in on one as well, just to hear how it goes. It's pretty impressive. So. The next meeting will be April 21st. Is there a motion for adjournment?
Make a motion to adjourn.
Second?
Go ahead.
Second.
All in favor?
Thank you, everybody.
We're adjourned. Thank you.
Dr. Turner, thank you.
My pleasure.
And congratulations.
Does that mean a jet's going to pick you up, take you home?
That worked. That worked perfect. Yeah. That's right.